Hi everybody, Johnny Wilson here from Nottingham Physio, and I'm with
Dan Green.
and Dan is our expert massage therapist. He is phenomenal, and today we are going to go through a tutorial on hamstring massage. And this can be very useful if you've had any type of hamstring injury, or if you've got low back pain, or if you're suffering from runner's knee, or if you're a runner and you're having these kind of kinetic issues. Dan is one of the top sports masseuses that I've ever worked with, and I've been in this game for a long, long time. And Dan will be going through what he's doing here on the hamstring. So Dan, just talk us through a little bit about what you're doing here.
Yeah, so first off, obviously for the area, have to warm the area up, make sure the muscle's ready for the physicality. So you see here the hamstrings exposed. Start off with some fairly gentle strokes, again, just to warm that muscle, get it ready for the activity. Some effleurage and petrissage here. You can see not too deep in the area, just kind of warming the whole area, not focusing on one particular part of the hamstring, but just trying to getting it warm and getting it ready.
Okay, and you can see here that the patient is lying on their front and knee is extended. Is that correct?
Yeah, absolutely. Yeah. So for the hamstring, they'll almost certainly always be on their front, but as we'll move on, I'll sometimes move the hamstring position slightly so I can get some different areas.
Okay, and then in terms of if somebody's had a hamstring injury, in terms of like a muscle strain, let's say grade 1 or grade 2, how many days post injury do you normally start working on massaging the hamstring? And I'm happy to give my shout on that as well if you want.
Yeah, so normally it would be probably, I would say, around about a week or so to kind of let any inflammation kind of die down. Obviously make sure the client is comfortable for me to physically touch the hamstring without it being too sore. It's almost like the first road to recovery, getting that muscle, getting the blood in, loosening it off. And, once they're past the first few days, they're kind of hopefully looking to get back into their sport.
Okay, so I can see here that you're putting a little bit more pressure onto the hamstrings here. Can you talk us a little bit about that?
Yeah, sure. So obviously once the hamstrings or any area is warmed up, you can then obviously start to go a little bit deeper, a little bit more pressure. So you can see there I'm using the heel of my hand and sometimes two hands together. Obviously you don't want to use too much pressure, but there needs to be enough where the muscle's reacting, you're flushing the blood out, flushing all the lactic acid out, getting some new blood in. So as you can see, they're going from kind of the almost at the back of the knee all the way up to the bottom of the glute. And yeah, as you go, kind of the pressure kind of goes more and more as you get more into the treatment.
So anatomically speaking, then the hamstrings they attach into the ischial tuberosity on the pelvis, and then they have a treacherous journey because they have to cross the knee joint. So they attach then onto the fibula and to the tibia. So they attach onto the outside of the lower leg and the inside of the lower leg. So normally what you'll see is you've got your biceps femoris, which attaches on the outside of the knee, and then on the inside then you've got your semimembranosus and semitendinosus. And again, look, there's a lot of fascial planes going on here, so that connects it then to the ITB band and the muscles below the knee. So do you work on the ITB band as well?
Yeah, absolutely. You'll see here, I'll probably, as we get going a little bit, you'll see my hand more to the outside of the quad, which, as you said, is the IT band. So with the hamstring, depending on where the injury is, you obviously want to hit the whole hamstring. As you said, it also crosses the knee, so I'll work down into the calf also, and then probably a little bit into the quad as we get on.
So I'm a guy who likes a lot of pressure. So, if I'm going for a massage, I want to be able to speak to the therapist, and I want to say to the therapist, look, do you know what, I'm feeling it here, but for me to come somewhere, like, and exactly what you're doing here, I like this kind of deep tissue, kind of deep, real strong sensation. What are your thoughts on that?
Yeah, I'm from the same school as you. Obviously, quite a big sports background for both of us. And I think, for people, especially if they're recovering, if they've got DOMs from exercise, there's no use just kind of tickling the surface of any muscle. You really have to get into the belly of it, which you can see I'm doing here, using my thumbs there. And, there is a fine line between, too much pressure. But I think most people, they want to come for a nice, firm, strong massage that's going to get deep into the muscle and really work its magic.
Yeah, I think look, if you're going to give up your time for a massage, whether that's 30 minutes or 45 minutes or 60 minutes, you want to feel like at the end of the massage that you're feeling the massage in terms of like, I feel like the leg has been worked in a lot of ways, or that area has been worked in a lot of ways. So and I think that look, I'm not calling anybody out here, but sometimes you can find that therapists get a little bit lazier, they're a bit tired, and they're not able to kind of put the pressure on, But certainly, I would say when it comes to you, you're quite proactive when it comes to speaking to the patients and asking them about pressure.
Yeah, I think you always have to really react off of them, and obviously the more you see a client, you get to know them. You know the areas they want more pressure and don't want more pressure, and I think we've all had those therapists where you kind of finish the massage and you're not really that satisfied. Like you said, it's maybe not deep enough, it's not into the areas that you specifically asked for. But I think that is one thing I kind of pride myself. I've worked a lot with athletes. And especially for them, you do want that specific pressure in those areas. So I kind of pride myself on being firm but fair.
Yeah, and look, for me now, personally speaking, as a physiotherapist and as a guy who's had plenty hamstring injuries in his time, I do pick up on adhesions in my own hamstring that I feel like the only way I'm going to get benefit out of it is by getting some manual therapy on it, is by getting some deep tissue work, is by getting a bit of release on it, and some muscle energy techniques as well. So I know that you're quite proactive in that, and also changing the position of the patient.
Yeah, absolutely. I think, again, as you see here, as I'm bringing the leg up, it's a really good way to get deeper in that hamstring. What I'll do is when I'm bringing the you can't see on my left hand, they're bringing the calf up and then dropping the lower leg, really stretches out that hamstring. So exactly like you said, you don't want to be doing exactly the same technique the whole time.
Yeah.
You need to change the pressure, change the area, change the side you're working on. You want to kind of hit it from all over. And obviously you can see here using that kind of balled up fist to get in the hamstring, but using the stretch of the lower leg to it be even more impactful.
It might be a little bit difficult for viewers to see there, but if you kind of look down towards the bottom left hand side of the screen, you can see that Dan is actually flexing and extending the knee, so he's getting some length into the hamstring as he's working up through that hamstring. So he's lengthening out that hamstring while then providing a lot of pressure in the opposite direction. So that's a calf-led direction, so a direction that is going towards the head. Now you can see here, Dan, that you're now moving the leg and not moving your hand. Is that correct?
Yeah, so it's almost like the opposite. It's more of a pin and stretch where I'm finding the area in the hamstring that's tight. Obviously there, right in the belly of the muscle, holding it, and then, as you said, flexing and extending the knee. So again, it's just a different technique to try. Everybody's different. Everybody's body's slightly different in terms of build and where they feel it and where they don't. So again, it's just about using a multitude of different techniques and seeing how the client reacts.
In terms of like picking up high tone or tight spots or areas where you're feeling like, what are your thoughts on that then? Like, are you able to feel that?
Yeah, I think so. I think sometimes you can tell. There's many ways. Sometimes you tell by the client's reaction. You can tell the areas they're feeling it more than others. Sometimes they'll tell you. Sometimes they'll just react in a different way. But normally for me, it's either experience of knowing probably where is a tight area, going for that area and then seeing how it feels, or just using that touch. Normally with my hands, I feel like you just feel those adhesions, you feel the tight areas, and then obviously you can hone in on them.
Fantastic. Okay, so then here we see that you've now moved the position of the leg. Can you tell us a little bit about this, please?
Yeah, obviously we kind of talked about, moving the leg around or, any body part around to kind of get it from different angles, going in different directions. Here we've just kind of flexed that knee up. So you can see that the ITB band on the outside is kind of exposed. And then I can then begin to work into the ITB band. I can also just get a little different feel of the hamstring and even a little bit of the sort of quad.
Lovely. And so what is really nice about this position then as well is that you're getting those lateral hamstrings, so you really are kind of getting in behind that biceps femoris. You're also getting into where the biceps femoris and the ITB band are coming in and kind of crossing towards that outside of the knee. So for those people who've got chronic hamstring strains or have a bit of ITB band syndrome or runner's knee, this is a fantastic position to have the patient in to help them with regards to any of those, really, like, you know. So we're not just talking about hamstring injuries here, but this is certainly, if somebody has had a chronic hamstring injury or an acute injury, this is the part that we would certainly be looking towards as well. So can you just talk a little bit through what you're actually doing here then, Dan?
Yeah, sure. So obviously a lot of the techniques are obviously fairly similar from the last position on the hamstring, but you can see here that IT band going from the knee to the hip. I'm just kind of working along that line. But yeah, you know, some people, obviously, say everybody's body's different. You know, I might be more effective on some people in this position, so they might not feel it as much normally. But once I move the leg here and I start working in deeper IT band right up into that hip, you know, they may feel it more than some people. So you try and give everybody, you know, good range of positions and, you know, different techniques, and you kind of see what works best here, just going right across that band.
Yeah, I think it's important that, you know, we realise that all these muscles, they're not just isolated, and they all work in unison with each other. So there's in effect there's no such thing as a hamstring, because what it is it's you know, so interconnected with your calf muscles, with your ITB band, with the muscles around the glutes. You know, it's incredible, really. So this is why it's important to make sure that you're getting that holistic approach when it comes to it. So I see you've changed your position here as well.
Yeah, exactly. You know, just the same as moving the leg up again, just kind of getting it from a different angle, coming the other way down the hamstring, this time down towards the knee, and again, just a different feel for people. Again, when I'm at the other end, I'm obviously closer to the to the bottom of the glute, and you'll see me get into that area a little bit in a second. So again, it's just, you know, different positions, different techniques. Obviously, depending case by case and person by person, but just trying to be as thorough as you can be.
Yeah, fantastic. Really important to try and get that head of the head of fibula where that biceps femoris comes in as well. So yeah, fantastic here. Like I like this positioning myself as well, because for those people who've had an acute hamstring strain, when you put the knee into a flex position, the hamstring kind of comes off its tension a little bit, so you can kind of get in a little bit deeper, and the patient isn't kind of guarding the hamstring as such. So it's another fantastic position there. So then I can see here now that you're moving down to the calf muscle. Can you talk to us a little bit about that?
Yeah, absolutely. Just obviously with, as we said earlier, the hamstring crossing over the knee joint. Obviously, the calf can get tight also, or can sometimes be, you know, a cause of the pain in the hamstring. So always move down to the calf and give that, you know, a decent amount of treatment as well. Obviously, you know, a lot of people that run, cycle, a lot of exercise really feel it in the calves. I've been seeing a lot of runners lately. And yeah, same kind of principles with the hamstring, loosening that calf off, working through the belly of the muscle, kind of slowly building up here, you know, very light, gentle strokes at the start, and then, you know, gradually building the pressure up as we go.
Yeah, I'm a big advocate again for that kinetic chain. I really don't see how you can treat a hamstring without treating the calf in terms of manual therapy. So this is, you know, something that I would certainly be doing myself as well. I like the fact that, you know, you're getting into that tissue, you're loosening it off, you're then looking for any tight areas, because all the time what we're trying to do is we're looking for the reasoning why. You know, is this person getting chronic knee pain or hip pain or hamstring strains because of tight calves, because of previous injuries to the calf? And we don't know that unless we're actually going down and interacting with the tissue, you know, getting a good feel for the tissue and seeing where is there high tone in the muscle, is there any kind of adhesions that you're feeling, or scar tissue, or something that might not feel the same boggy underneath the hand as well, like, you know. So what are your thoughts on that then?
Yeah, I mean, to be honest, most of the time when I work on people's calves, I think they kind of think their calves are fine, there's not anything wrong with them, and then normally as soon as I get my hands on them, they can tell that, you know, especially on the outside, the inside, where I'm kind of working with my thumb now, those areas get very tight and they just kind of go undetected really. But as soon as, like you said, you get your hands on them, it really kind of brings that soreness to the surface, and then you can work with it. But yeah, it's just kind of, you see there, rotating the leg, trying to find those areas inside of the calf, outside of the calf, and then right through the belly of it as well. There's always some tightness.
I certainly know on myself, I'm towards that lateral aspect of my own calf, that it's very tight from episodic chronic tears of my calf, and I'm sure that's why I've had a lot of issues with the hamstring. Now it could be the other way around as well, but get working on the calf is absolutely crucial, and you need to spend some time. Like, so for example, then if someone's to come up to you for a massage on their hamstring, like, are we talking about 5 minutes, 10 minutes? Are we talking about a session that's a half an hour, 45 minutes to an hour? What would you recommend first? Maybe somebody's come to you for their first session.
Yeah, I mean, I would say if it was just the hamstring, whether it's an injury through sport or something they're just feeling, I think probably a 30-minute treatment would probably be enough, which is what you can see me doing here in the background. So it would probably be, obviously the majority would be directly on the hamstring, probably at least 15 minutes on the hamstring, and then maybe 10 minutes on the calf, and then you'll see a little bit at the end. I'll just get into the glute and just try and loosen off the glutes and the hips a little bit. Okay. So that would be my split probably.
Like in the camera shot here, you probably can't see it. But you were doing a little bit of work on the Achilles. Yeah, well, I think that's just absolutely crucial as well. I mean, I do a lot of work on the Achilles, with any of my hamstring or calf patients. It's a case of, how could you not do it? Again, I will probably myself, do a little bit of work on the plantar fascia. I like to get all that done. I might do some mobilisation around the lumbar spine as well. This is important for me. So when people are coming into me with a hamstring, I'm not just looking at the hamstring itself. We're going, I might take a little bit more time. I might take 45 minutes. I might take 60 minutes. But when you're working on somebody's like lumbar spine, and then you're working on their hamstring, and you're working on their glutes, and you're working on their calves, and you're working on the plantar fascia, and they're going out after 60 minutes or 45 minutes or 30 minutes, and they feel like the whole area has been worked, then they always have such a good experience. It's, what I mean, it's incredible the results that we're getting. So I can see here then that you've changed position here. You've got the knee bent. You've got one hand on the glute here. Can you tell us a little bit about what's going on here?
Yeah, so this is actually one of my personal favourite ones, which I've had done to me a lot, and I find it really, really effective. Not just in this case, obviously we're doing it for the hamstring and the leg, but for the glute, for the hip, for the lower back, really good way of loosening any tension in that area. So as you can see, I'm using the lower leg as kind of a lever. And my left hand there, you'll see my thumb now is kind of pinning a point in the glute. So I'll find an area of tension, an area of tightness, an area that obviously the client is feeling it, and then I will apply the pressure, and then as you see, I'm using my right hand to open up that angle, and what it's doing is just putting some pressure through the glute. It's very hard stretch to obviously replicate by yourself, so it's getting a therapist to do it is a really effective way of loosening that area.
Yes, I can see you're going through a lot of internal and external rotation of the hip, and a lot of people will talk about piriformis syndrome and the piriformis tightening in around that sciatic nerve, which can cause sensations down into the hamstring, which can mimic or manifest as musculoskeletal issues. So a lot of times you have this kind of anatomical variation where the sciatic nerve, it actually goes through the piriformis rather than going above it or below it, and sometimes when that does get very tight, it can almost like strangle the sciatic nerve, which gives you these type of radiating pains into the hamstring. So again, I think this is a really important technique not to miss out on. Why would you not treat around the glutes when you're when a patient is presenting to you with hamstring issues? Of course, you'll always be doing this after a very thorough assessment. Anything to pick up on that there?
I completely agree. I mean, this one's a must for me. I mean, personally for me, it's been really good. Like you said, sciatica, lower back pain, glute pain, hamstring pain. It can cover so many things. But today we're so sedentary, sat in an office, sat at a desk, on the train, in the car. It's a really good one just to loosen off all of that area, and I get some great results.
Great stuff. Well, Dan, thanks a million for that. It was fantastic. That is a masterclass on hamstring massage.